there's anything we learned from the past years, it's the importance of prioritizing our health and well-being. While there are new variants emerging, new restrictions being implemented, and the steady need for medical services, we see the hope of this pandemic slowly becoming an endemic. This now begs the question of, what's next for the Philippine medical industry? Today, we will be talking about the Philippine healthcare system's pandemic response and recovery plans and its future plans to transition to the digital space in a bid to bring healthcare to more Filipinos anytime, anywhere. I am Ann Gautier and welcome to Kapihan sa MB. We have with us today an impressive and accomplished roster of representatives to talk about the Philippine healthcare industry. Let us welcome Mr. Jose Xavier Eki B. Gonzalez, Chairman of the Board of the Medical City. Mr. Gonzalez started out his corporate entrepreneur skills within the Lopez Group in developing their businesses. Prior to joining the Medical City, he held senior management positions in companies across a range of industries in the Philippines. Also joining us is the Medical City's president and CEO, a cardiologist by profession. He became the 45th national president of the Philippine College of Cardiology in 2009 and a conferred fellow of the American College of Medicine in 2010. He was awarded Distinguished Fellow of the PCP in 1999. With over 40 years of medical and executive experiences, he spearheaded bold, world-class reforms wherever he sits. Please welcome Dr. Eugenio Jose F. Ramos. Thank you, gentlemen, for joining us. Thank you for joining us today, Mr. Gonzalez. Or can we call you Sir Eki? What would you prefer?
Eki's fine. My real name is Xavier. The real name is Xavier. It's X. So Ekis. And that's how it became Eki.
So not Xavier, Xavier.
Xavier. But X Ekis, Spanish.
Good to know.
Okay.
Good to know, Sir Eki. Now, maybe we can get started then. We are faced with optimistic data now when it comes to the decline in the COVID cases in the Philippines, which is great news, right? During the start of this health crisis, what adjustments and programs were implemented by the Medical City when it comes to dealing with patient care and ensuring the safety of your healthcare workers?
I think that's really something for Dr. Jean to talk through. But what's clear in terms of when we started is that we made sure that in the initial phases, all HCWs were very well protected. And the main indicator for that was we had at one point maybe 700 to 800 people living in our hospital, not going home, so they wouldn't be exposed to the vagaries of COVID.
They were living in the hospitals.
Yes, and then also we expanded it. So at one point, there were people who were living in the Miracle compound. There were those living in La Salle who were very helpful to us in the beginning as we tried to understand the infectious aspect of the process. Really, as a result of this, I think we're proud to say that we had no HCW deaths in our hospital since the beginning of the pandemic.
That's fantastic. That's true sacrifice from everyone.
Yes, true sacrifice from everyone. Even down to our janitors, the people who help clean our hospitals. We also house them. And our security guards.
That's so wonderful.
Yeah.
The great news that no one passed.
And then I think the other thing that's been done and is that through Dr. Jean, there was a centralized committee that basically managed the gating process through different phases of the pandemic.
So what do you mean by gating process?
Where you go for testing. We had a COVID, non-COVID section. How much testing you need to get when you go through the ER or you go through for an operation. Those sorts of things. And the third thing I think that was incredibly important is that in order to build confidence, we stayed open. We were always open and we became even more open. So for example, our clinics, we have 50 clinics through all of Mega Manila. They never closed during the pandemic. They were always open. And when the HMOs were very resistant, um, we set up a whole system for getting people into the hospital and triaging them there. We converted a whole lobby into something that was, I don't know, Gene, as
We
friendly.
call it the concierge.
The concierge service. You want to talk about that? That's incredible.
Well, we did a lot of repurposing, Anne. Pleasure to be here.
Yes, welcome, Dr. Ramos.
Okay, we did a lot of repurposing, and some of course, some of the wards that we had to close them because the non-COVID cases were not coming. They were afraid to go to the hospital,
Yes.
and we were really stuck with predominantly COVID during the first few months. No? So the ones that were closed, we repurposed them, and they were used as dormitories for some of the nurses and some of the other workers of the hospital because transportation was difficult at the time, the lockdown at that time. So the other thing there is the HMOs also opted to stay home, right? And HMO is the one that provides the permits for coverage. And so if there's nobody there, then we have problems with patients not being able to get their HMO accreditation, their permit to go on with the tests. And so there is going to be queuing, a lot of queuing and a lot of crowding. So we opened one area, big area, and converted it into a concierge. And we put our personnel there. We also repurposed quite a number of our personnel to handle it. And so we did a lot of work for the HMOs, in fact, and which was appreciated by the patients.
So it really requires a lot of organizational skills.
A lot of creativity as well.
Exactly. So speaking of creativity, the pandemic has also presented opportunities to be creative and innovative when it comes to making health services available for those who need it. How was the medical city able to respond to this? You spoke already of a few things.
Well, as mentioned by Eki, but good thing that Medical City is a big hospital. We actually had two separate emergency rooms, no? One for the adult and the other one for pediatric. There were no pediatric patients going during the pandemic. The parents wouldn't dare bring their children there. That was also one problem, no? So we converted the children's emergency room into a separate COVID cases, non-COVID, and the big one was the COVID. And then we came up with this, which we were awarded actually, a two hospital in one complex system where we had separate COVID facilities and non-COVID facilities, separate entrances, separate elevators, and separate floors, no, for COVID and non-COVID. So, and then also the ones that were really covering for COVID stayed with the COVID cases, and the ones that were covering for non-COVID were also. Even our ICU, we had ICU for COVID, and separate ICU for non-COVIDs. And we had to repurpose quite a number of the rooms, turn them into negative pressure rooms. So, we of course spent some money there, but we were also able to make patients feel more assured and secure that they were safe. Now, during the time, a lot of patients without COVID were really afraid to go to any hospital. But that also constituted quite a serious problem because if you have serious problems and you delay, if you have a surgical situation, for instance, and you delay, you really encounter a lot of problems there. So we had to deal with that as well, and do come with our social media programs to tell patients that it is completely safe to go to the medical city. And that was good.
Social media. So there's a lot of future
already at that time
elements that we could use, which we'll talk about a little bit later on. Very curious about. Thank you for sharing that. Mr. Eki, you've written several articles regarding the country's economic response caused by the pandemic. So before we get into the medical side, how do you think our economy can bounce back from this?
Well, our economy is a natural consumer economy. The 70% consumer, not an investment economy like you might say for Germany or even China. So our two major service businesses, which is the OF business, the Overseas Filipino Worker business,
Yes.
and the BPO business, I think they at least survive and even more than that, thrive. In the beginning of the pandemic, people thought that remittances would drop 30%. Instead, for last year, they were flat. And this year, they're growing in the mid-single digit range. So despite the fact that maybe the only sector that really suffered were the seamen who are handling the cruise ships. But they had to be repurposed so they can go into the commercial vessels where logistics is now a problem. So, and then of course our nurses. Our nurses are so much in demand now that they had to set a quota for nurses leaving the country. So we had a little bit of an initial decline, but there's a significant recovery in the overseas Philippine market. Now, with respect to digitalization, has more greatly enabled the BPO sector. Contact centers, back offices, our capacity for English, our strength in services like accounting, for example, and even healthcare. These kinds of things are going to allow us to bounce back relatively quickly. I should also say so that although that I think the manufacturing sector has been able to gate well on its own, so the only sector you have to worry about is agriculture. So we've seen this during the first bounce back, second, third quarter of last year. It was quick. It was more than anticipated. And even during the second bounce back, second quarter of this year, it was stronger than people thought. So if it declined by 11%, you grow by 7-8%. The NEDA secretary says that we'll recover by 2022, not 2023.
Recover by 2022.
Yeah, we'll bounce back. And I think because of the structure of our economy, we are poised to do that. I just believe that. But that's a personal perspective.
And how do you think the Philippines can, with what we've experienced, how do you think the Philippines can create better health infrastructures to respond, because we will be getting that, most probably it will happen again, to the next health emergency or the one? Okay. How does the TMC Care Anytime, Anywhere appear into this?
Those are two questions, okay?
Yes.
One is about the overall economy. The second is about TMC. In the case of the economy, I think we have to understand that dealing with pandemics, and you're going to have a lot of pandemics coming from you start with the Spanish flu, it metamorphosed into Ebola, and all these diseases that came in stemming from the flu virus, actually from the Spanish flu, and you're going to have more of these over the last couple of years. We have to understand that healthcare is not a sprint, it's a marathon. And so we have to build the infrastructure that will allow us to test, treat, and trace. So those three things. Now let's talk about testing. What can you do about testing? When the pandemic started, we had only one laboratory capacitized for this, the Research Institute for Tropical Medicine, which was also a regulator. Now, if you have a lab, a government entity who is also a regulator, it's very hard to spur innovation. So during the first few months of the pandemic, we were stuck at less than 1,000 tests per day. Only after 3 months did all these other molecular laboratories sprout out over the country, manage through the ramp up. But you have to separate the regulatory and the economic functions that have to do with health. So that's about testing, okay? Now about tracing. We had absolutely no tracing capacity. And the way to do that is to create a really good CDC, Center for Disease Control, which is across all countries in the globe, and to build that network here. We created a National Disaster Control Group, but that's different. And we didn't have that Center for Disease Control the way like Vietnam had it. And that's why they were able to keep initially the cases down to 0, down to the barangay level. So we need to do more of that on the trace. And now on the treat side, you know how the Philippine private hospitals were really pressured to increase their capacity,
Yeah.
but not get paid, We have these field health problems.
You're aware of that.
So I
Yes,
think
very much so.
the only one that can really respond in a major way to this is government. And so government has to understand, and that was our advocacy in the beginning, that they have to dedicate public hospital capacity to any of these surges, which they did a little bit belatedly, and which they should do more of. And that way, you minimize the lack of confidence of the public in our being able to handle severe cases. So one more thing I wanted to say, two more things I wanted to say. One is, in the process of encouraging innovation, we have to open our doors. If India can develop a vaccine industry or a pharma industry that accounts for 70% of WHO prescribed drugs, why can't we do the same? It's not necessarily a heavily scalable industry like semiconductors. You're dealing with chemicals, you can import them. It requires a lot of IP and intellectual knowledge. We can do it here. So, these kinds of things can be supported by DOST, Department of Science and Technology. And the second we have to do is we have to give appropriate funding to healthcare. We're only 4% of GDP. Vietnam is 7% of GDP. The developed markets are 10% of GDP. Why are we unable to pay private hospitals for healthcare work that they do? Why do we tell them to increase their capacity and yet we can't pay them for it? So these things have to be reconciled by government.
Which hopefully we will get there.
Yes, and then the second question. The second
TMC.
question about TMC. Well, as I said before, we stayed open. That is a tremendous message to the public, and we continue to communicate that message about being totally and always open. Second, we redefine handling of patients, not only within the four walls of a hospital, but even in their homes. So during the peak of this last surge, we handled over 1,000 patients. At the peak, we were handling 100 patients. So at their homes. So if we have 300 beds in the hospital and patients are afraid to do beds in the hospital, they want to be handled at home, we're able to do this there.
They had this home care service.
They had this home care service. So I think that's one big example. I'm sure Jade can cite
Well,
others.
it's part of the reaction to the fear. Because home care as a concept has been around for so long, never took off. But when...
Really, it has been around.
It has not been around as a concept. I was just an intern at the time when our CEO at the time was telling already that we should really prop up home care, but we did not put money there, and so it never really took off. But when the fear really magnified, and there was no way that we could handle we had capacity issue as well. And there was crowding in the emergency room. We had to go to home care. But at this time, we already had the digital technology, which made it much easier. So in a way, the pandemic actually accelerated digital transformation of the hospital. Because there was less resistance now to the new things that came with it.
Yes, which I'm looking forward to chatting with you about earlier, later on, because that is something that I think changed the Philippines, digitalization with this pandemic. But with TMC Care, anytime, anywhere, I'm sure audience members are curious and they would like to know if this is also the direction being taken by your other branches in South Luzon, Clark, Pangasinan, and Iloilo?
Well, that's precisely why we are able to say medical city and care anytime, anywhere, is because we have 5 hospitals here in the Philippines. We have 1 in Guam. And then we have 50 clinics, ambulatory clinics. Predominantly here in the NCR. So more and more of these patients now are actually ambulatory, and they don't really require hospitalization. But if they require hospitalization, they can choose any regardless of where they are. So we now complement that with the digital technology that we have. We have telehealth, telemedicine, virtual care. No? So now we are going into ambulatory care. We are going to home care for people who have to stay at home. We have hospital care. And then we have virtual care. And then we have also community care where we collaborate with the LGUs and the other, we develop partnerships with the local governments.
So, with everything that Medical City has accomplished, it is also worth noting that the Medical City has been accredited again by the Joint Commission International. I believe this is not the first accreditation from JCI achieved by the Medical City. Can you tell us more about this, Dr. Ramos?
Yes, thank you, Ann. This is our sixth. We get re-accredited every 3 years. We started our first getting into JCI in 2006, and thereabouts every 3 years up to the present time. This year, we had our sixth, but this was different because it was at the height of the pandemic. And so we had everything online. And it was just as tough as, the actual face-to-face because we had to go through all the standards and all the measurable elements. Just to tell the public about JCI, Joint Commission International is a accreditation committee or a body that is actually focusing on quality and safety of patients. And when we talk about quality, we're not just talking about, it's everything about quality. It's about the structure, about the facilities, about the where patients are taken, about medication errors, about how the doctors are qualified and credentialed, whether the charts, the documentation is correct, whether the processes are such that the likelihood of any accidents, medical accidents can happen. All of this are covered. So really a lot of standards and over 1,000 measurable elements that we had to go through. And we needed this because while it's good in terms of reputation that we are JCI accredited, and that's where the international patients coming in will always inquire about the standards that we have. So when you are JCI accredited...
Really, international patients.
Yes, the coverage for insurance is also good. No? But it's also good for our organization because it keeps us on our toes, always trying to see whether we are up to it. And actually the challenge was sometime middle of this year, I was being asked by the group whether we should pursue our sixth reaccreditation because of the pandemic. But looking at where we were and how we had gotten used after 6 times, getting used to all these standards, we knew that we could make it. So we actually made it. Yeah.
Wow, that's an amazing feat. And that's really something to be proud of.
And there's one more. We actually had our third recertification for acute myocardial infarction. And we are the only one in the Philippines. Acute myocardial infarction is a heart attack. And when you have a chest pain and then you are brought to the emergency room, a lot of delays happen and decision making, wrong diagnosis and things like that cause death. And a lot of patients actually don't make it to the emergency room or actually just reach the emergency room and then they do a CPR at that time. So we have this acute myocardial infarction certification program, which we actually applied 2020, that was 6 years ago, and this is our third time, showing them how stringent we do it in terms of making sure that the moment that the patient is brought to the emergency room, intervention happens and we are able to reperfuse right away. Because of that, and then the treatment and everything until the patient leaves the hospital, after 30 days, after 90 days, and after a year, they are followed up, we can really proudly show the Philippine Heart Association, the cardiology group, that our numbers in terms of clinical outcomes are significantly low because of this thing. So we are happy with that. We are the only one in the Philippines.
The only one.
And one of the 11 in the world, actually, with this acute myocardial infarction certification. Yes. So,
Fantastic.
you have your heart attack, go to Medical City.
That's good to know. Very good to know. At least patients will really feel safe there.
Yeah, door to balloon in an hour.
Yes.
Door to stent balloon in an hour.
60 minutes.
60 minutes.
Within 60 minutes.
Incredible.
Yes. But it's not so easy because decision making.
Yeah.
Sometimes the family waivers, sometimes the patient, waivers and all these other things.
There's also so many different
So
factors
many
that come
factors,
into
yes,
play, but
yes.
it's good to know that we're at par at international standards.
So now we go into the future. Were you asking about the future?
Well, first, can we first congratulate
Okay,
you,
thank you.
on being six times in a row and 3 times in a row?
That's right.
I believe there are very few hospitals in the country with this type of recognition. We can only imagine how difficult it is to be recognized, yet the medical city has been recognized 6 times and 3 times. So congratulations
Thank you.
again. Now, it looks like the medical city is staying on track even in the face of a global crisis. So with that, yes, please tell us, Dr. Ramos, the future of medical city. How do you see the future of the medical
We had
city?
our exciting time with the entire team, not only the Medical City Main, Ortigas, but the entire enterprise, which includes Medical City Pangasinan, Medical City Clark, Medical City Main, of course, Medical City South Luzon, and Medical City in Iloilo. We got together to really work on our strategy for the future, which starts 2022, and that is where we have TMC Care anytime, anywhere. The convenience, as talked about by Eki here, instead of patients coming to the hospital, the brick and mortar attitude of hospital care, there are now more and more patients going into outpatient ambulatory. And now more patients now with the technology would rather go home care. And with technology, the future is the convergence of science and really advanced science in terms of molecular medicine and precision medicine and technology, which is represented by the smartphone. No? So when you put it all together, then we say, you don't really have to go to the hospital when you need care, right? And then a lot of times, the bigger market actually is not the illness medicine. The bigger market is the wellness movement. People now are becoming more and more, I'm sure you are part of that, more and more concerned and more really focused on keeping themselves healthy.
Before you get ill,
That's
let's
right.
take care of ourselves first.
So
right?
we are going to go into that as well, which is not going to
Wonderful.
be hospital-based. This is going to we are going to have remote monitoring. You have your device, your wearables. We call it the wearables, no? Where your watch, for instance, measures your heart rate and all this everything. Your Fitbit, those are wearables that are going to be utilized more and more now. And now, as we really encounter more and more cases in our hospital, we are reading a lot of imaging into thousands, hundreds of thousands. So these are all patterns. When you read, you actually, the machine can actually learn in terms of the patterns of the reading of a chest X-ray. And if you're dealing with 500,000 chest X-rays, the machine can tell already based on the reading that this is normal chest X-ray, or this is X-ray with possible tuberculosis, or there seems to be a tumor or a fibrosis. No? I'm talking about algorithms. No? So that's artificial intelligence.
But before we talk about AI, I'm very curious about that. But before that, let's say the first step, because it is such a foreign concept for a lot. Let's say I'm a patient. I'm just curious to find out about this virtual care and in-person or traditional care. Can it be integrated seamlessly?
Well,
First,
the
before,
seamless
let's say before
part
the chest
is,
X-ray?
the seamless part is always the challenge in the execution of the strategy. So, in other words, as we go into this, we want to make sure that it becomes seamless because we are going to be measured by patient experience. And we actually actively measure patient experience. How does the patient feel about what she went through, right? So in our standards, patient experience really counts a lot. No? So we are measuring that. And the execution of all this, the seamless, it becomes a hybrid. You either go to the hospital or a mixture. You can stay at home, or you can keep in touch with your doctor through virtual care. And we can establish certain linkages with the different organizations and units in the local government, which is community care. So regardless of that, it really requires technology where we centralize the data of the patient electronic medical record.
Because you mentioned, okay, Fitbit. So we have all these different tools that
Yeah.
even the doctors can use as well.
That's right.
So it's really using technology to our advantage.
Yeah.
Very well.
Okay.
I have to use mine then more. I have one and I haven't been using it. Now you've
Okay.
motivated me.
I think just a general comment. The old model, Eugene would know, lone wolf practitioner, doctors recommending other doctors, is going to transition into something much more institutional. When it transitions into something more institutional, then regardless of whether you get your care at home or at a clinic or in a hospital, the seamless interface and the quality of that interface as measured by JCI, and all of that goes along with it, including our 160 residency and 40 fellowship programs that ensure that quality, is what sustains the patient care through his whole journey as he goes through life.
But maybe Anne needs to understand what a lone wolf is. A lone wolf is a traditional. I am a doctor. I have my own private practice. If I am not available, then the patient has to, worry about that. No? But when you really have institutional, and regardless, you can be at the clinic or you can be at the hospital, when there is a common electronic medical record and there is really a collaboration with the doctors, like a group practice.
Who are certified properly.
Certified, credentialed by the medical city, of course. No? So there is a convergence, and then there is assurance of quality.
Some form of committee, is that
Yes,
right?
it's like a group practice in a sense.
Okay.
So regardless, so the patient goes through it, and the convenience and the experience and the assurance that he or she gets high quality care.
And we don't lose that
No.
humanity feel in the virtual
That's always
care.
a challenge, isn't it? Yes.
It's a challenge.
Yes, that's right.
But
Yes.
the hybrid seems to be what we've learned from the pandemic.
Yeah,
right?
that's right.
And that's what you have to sustain institutionally.
But the humanistic
And
part.
there's so many factors in this institutional branding, from the clinical cooperation among doctors, to how you triage patients to different channels of delivery, to the quality of your service whenever you encounter them, as manifest with JCI, including the training infrastructure that you build with your residency as a tertiary hospital and fellowship programs. And finally, Gene, I know, to the quality of your research, that you are a continuous learning organization where you just don't accept protocols for treatment, but you create them ultimately
I love
in a
that.
personalized way.
Yes.
Because each person with your own genome sequence, your own genotype, and your phenotype in terms of what you acquire through the environment makes you different. And with a team that approaches you as a person with all the subspecialties and all of the intelligence, okay, that will give you the best
But
support.
what we're saying, Anne, is we're there already. We are there already. And all we need
Because
to
you've
do is
had
to
it
go to the
prepared
seamless.
since the 90s, and here you are.
Yes, molecular medicine,
fantastic.
convergence with digital technology. We have now the Internet of Things. We have now AI, and all it matters is really putting all these things together. And the challenge is
Yes.
execution, seamless execution of this.
So you've mentioned AI. Can we talk
So
more about it?
we are starting. We have started this with the chest X-ray imaging, and then we also have started in terms of the mammograms for the women. The mammograms, the AI utilize about 500,000 mammograms to show which one is cancer, which one is not. And then we also have the other one for retinopathy. And this one is exciting because what happens there is that a patient in the province where there are no advanced retina experts, for instance, all they need is really have the retina taken by photograph and then sent through digital to Manila here, the medical city, and the diagnosis is given, and then we are able to actually move from there.
That's
So 3
surreal.
so far.
That's really, I mean, it almost feels like a foreign world. I know that we need to get there.
We need to get there, yes.
And I know when we're there, it's not as daunting as it seems, but it's exciting. So it's actually great and exciting to hear that institutions such as the medical city are thinking forward. Because this also means the medical city could very well be the first virtual hospital in the Philippines?
Well, the virtual hospital is already something that is talked about by the group that is in charge of virtual health. So they are working on that, and then it require some investments there. So the virtual hospital is the way of the future. In the future, we're talking about 2022, 2023. Yeah.
So what would you say, what would this mean for the medical city team achieving this feat?
Well, it really means to improve capacity, the capacitating our staff, getting the experts that we need as well, and then developing a lot of our people who are not quite there yet, but they have to make the leap for that. No? So it means a lot of work. It means a lot of work and a lot of investment as well.
But exciting.
It's exciting, yes.
Just remember, technology is just a tool. So you have to have a purpose for that tool. It's not going to replace the doctors. It's going to help them do better diagnosis. It should be extended into the public health space, as Jean was talking about. So you can diagnose eye ailments remotely. Or if you have your chest x-rays in place, system in place, you can effectively do remote radiology and determine whether somebody has a propensity to have COVID. And then he can be, or TB, and he can be brought into the appropriate
part of
treatment
the problem
center.
in the Philippines is that most of the specialists are actually concentrated here in Manila. And in the provinces, they may have the equipment, but they don't have readers. They don't have the experts because they prefer to stay here. So what we can do is we can have teleradiology. And so they just send the images, which are digitized and sent to us. And then we collaborate with the doctors or the hospital staff there in that province that we
It's
have.
fantastic because it's really giving it access to everyone.
That's correct.
Yes.
Yeah.
And that's highly appreciated. And like you mentioned, Mr. Gonzalez, you said healthcare is not a sprint, but a marathon.
It's a marathon.
So it's a lot of work, but thank you and congratulations. Thank you very much for such an informative session. This is Kapihan sa MB. We'll be back after a short break.
We encounter problems every day. Which vitamin should he drink? What food should I eat that would be best for the baby? Why is his temperature up? Why is he crying? What do I do? How will I do this? With the Medical City Online, we make sure that you have one less problem to worry about. The answer to all your healthcare questions. The easiest, simplest, and safest way to world-class healthcare experience. The assurance that you are well taken care of. When you want the best for your child, the Medical City Online is here to make that possible.
That was such an informative and worthwhile discussion. Dr. Ramos and I are here with Sir Eki again as we tackle some more questions about today's topic. So, going into the third year in this long battle with COVID, is it time to face the music? The virus is not going away anytime soon, and that we should really start learning to live with it. Question is, Sir Eki, is the Philippines ready economics-wise and health-wise?
Well, that's an interesting question. You've combined a question about health and economics into one. And I did talk a little bit about it before. From a health point of view, I'd go back to what happened with the Spanish flu. That was a 1918 to 1920 disease. The world's population was something like 1.8 billion. Now it's closer to 8 billion. All right? 30% of the population got it. It was transported in the middle of World War I through all these soldiers that cramped through Europe and the United States. We had deaths of around 50 million, at least. 50 to 100 million was the estimate. Now we're talking about 300 million or less being infected and maybe 5 million deaths. So we should be glad that, or maybe it was serendipity, that we were able to respond very quickly. And how were we able to respond quickly? Well, first of all, the flu metamorphosed into different viruses of influenza and then suddenly showed up again in a different format. But what we're doing, what we did over the years is because of the value of science, we were able to sequence the genome of that in 3 months, develop a vaccine in 9 months, and now we're almost at the level of having oral antivirals as prophylactics or as preventives for this to happen. So it is moving into that endemic phase. And sometimes, luckily for us in the Philippines, we are 1/6 of where the West was in terms of infection, in terms of deaths, because we practiced local lockdowns, although we were the most severe, which may have been too much. But at the same time, because we didn't try a zero COVID strategy of having no COVID, we're not like Vietnam, which is now suffering a big surge, or what happened with New Zealand, and where their cases are now at 23,000 down to 14,000. We're down to less than 1,000. So I think we've licked it so far, but let's not rest and relax. Let's always be aware and let's set the stage for the future. As I told you, we have to have national champions for research and development to build resilience. And that's what's really important here in healthcare, to build resilience. We need to understand how we can separate regulatory and economics and business so we can facilitate innovation within the bounds of proper management of health, okay, which is what you should do as a regulatory institution. So we have those initiatives that we can work on. And I think we have to open up without missing out on the basics that got us to where we are today, which is masking, social distancing, and care, and ideally a better public-private partnership.
Thank you. It's a wonderful answer. Thank you very much. And it gives us hope as well. Dr. Ramos, what do you think is the biggest lesson taught to us by the pandemic that can serve as our guide in terms of effective healthcare management?
Well, maybe, Anne, I can share with you exactly where I was in terms of my mindset during the first few weeks of 2020, when it first started. Remember, during that time, we didn't know so much about the virus at that time. And everyone was afraid. Everyone was uncertain about what's going to happen. Our emergency room was swamped. The nurses were a little frantic. We were running out of supplies, or our PPEs. And, people were just scared. And I was there and I couldn't go home because I said, how can I go home, Then my learning here is that in a crisis like this, you can never do it alone. And that's when you appreciate the resilience, as was mentioned, and the character of people, not necessarily people in position, but position of people who showed up, stood up, and really became part of my immediate team. So I guess the lesson here is that you can never do things by yourself. You will really need help. And that's what I did. I had to call a lot of my colleagues, the other CEOs and other medical directors of the big hospitals, And we banded together, we exchanged notes, and all this. It gave us strength. No? And I think that's one good lesson that we have, that we are in a community. We also established relationship with Pasig and Marikina LGUs. And talking with our mayors gave us, that feeling that we can do things much, much better and a lot more when we are together. So the lesson thereon is really, when you're faced with something like this, there are two choices, and the question is, well, maybe the answer is that what is best for one is not necessarily what is best for all. And eventually, in a crisis like this, what is best for all prevails. And that's a lesson that I learned, and that's one thing that I realized, that in anticipation of the next pandemic or endemic or a crisis, you need to prepare by setting up your core team of well-prepared and mentally capacitated people in terms of how to face these challenges that we have. That's a good lesson. And lesson again is, telling everyone that what is best for you, because you are focused on your self-interest and your fears, may not be what is best for everyone. And what is best for everyone is what's going to prevail.
And in many ways, past that, what's best for everyone becomes what's also best for you in the end.
Exactly. After the fear and after all the panic and everything, what is best for everyone really becomes, what is best for all becomes best for everyone, actually.
Thank you. And with that, are there any thoughts or final messages you wish to tell our viewers with regards to prioritizing their health?
The most important thing, I guess, and this is part of the vision of the medical city, is for every Filipino to really know exactly why health is important. We would like to develop a health-seeking behavior that Filipinos should learn to be responsible and accountable for their own health, and not to depend on other people, not to the government, but to really depend on themselves. No? And that requires them to kind of change the way they live and change the way they behave. No? And I think if everyone does that, then the government will have its own part in terms of public health.
That's great. How about you, Sir Eki?
Well, I think we all have to change our attitude towards COVID. I don't know if you recall this, but in the beginning, people were concerned that if they touch plastic, that would also communicate COVID to you.
That may still be the case.
No, that's not what the science says. I mean, they said about face shield. Face shield is like 0.2% contribution to COVID. People were afraid of, they had to wear masks all throughout, even outdoors. But what the science is saying now is, just do the basics, wash your hands, keep social distancing, do a lot of walking. And you don't have to wear masks if you're outdoors. A lot of that's being practiced now. And especially in our weather, it's such a great thing because the virus dies quickly. So most important thing though is we're being successful because we've had a good combination, albeit we have not very good economic status for natural immunity and vaccinated immunity. For those of you who are not vaccinated yet, get vaccinated. It makes our country better. It makes the grouping better, and it helps keep herd immunity together for us. So that's my message.
Thank you. And it's really that we're going through an endemic at the end of the day.
It's endemic. It's not a pandemic.
And thank goodness we have TMC Care. Anytime, anywhere.
It's our pleasure. Always a pleasure to serve the Filipino communities.
Really appreciate it. Thank you very much, Mr. Gonzalez, Chairman of the Board of the Medical City, and Dr. Ramos, the Medical City's President and CEO. Really appreciate your time.
Thank you.
It's our pleasure. Thank you, Anne.
The COVID-19 pandemic in the Philippines had made its presence known in March 2020. It caused great panic, most especially to healthcare institutions. This period allowed us to see and realize how public-private partnerships can make a big difference in terms of effective pandemic response. The Department of Health and the local government units in partnership with private institutions, definitely stepped up and made a huge difference. To enlighten us more about this and to talk about the other facets of Philippine pandemic response, we have with us the Undersecretary of Health for Public Health Services team and the official spokesperson of the Department of Health, Dr. Maria Rosario Singh Vergere.
Yes, good afternoon, Anne, and thank you very much for inviting us into this forum. In behalf of the Department of Health and our Secretary, thank you very much because we had been honored to have this kind of platform to give more information regarding our response to this pandemic.
Good day to you, Yusek Vergere. Thank you very much for joining us today, and we really are looking forward to learning more from you today. Okay, Yusek, let's start. Could you tell us what makes the public-private partnership an effective effort in responding to the COVID pandemic?
Well, first, Anne, I just like to say that government cannot do it alone. Government cannot do it alone, especially that we have this very huge crisis facing the Filipino people, our government, and actually the whole world. The public-private partnership has been very effective in our response because we have adhered to this principle of a whole of government, a whole of society approach, whereby all actors and in the different sectors had been tapped so that we can be able to have more efficiency in our response and more effectiveness in our response. We have seen how our different sectors, aside from government or public, has been able to provide adequate and effective assistance to government during this time of the pandemic. Private sector has provided us with resources. Private sector also has provided us with technical expertise. The government doesn't have that much resources, especially during this time of the pandemic, but the private sector stepped in and provided us with the different resources that they have, both financially and also both technically. They were able to provide us with their experiences, with their technologies, and therefore our response has been comprehensive, our response has been effective, and we were able to tap the different sectors in government and outside of government, which made our response really adhering to this principle of whole of society and whole of government approach.
Now, you mentioned technology, right? The pandemic also brought about the global trend in the industry, and that is to transition everything digital, from consultations to admissions. Now, while a few hospitals in the Philippines were already implementing digital transformations, how did the pandemic become a catalyst to this transition for all?
Actually, what you've said, no, it became a catalyst to this transition. But if we look at our history, ever since, no, I think that was in 1998 when this National Telehealth Center was already established here in the country. It was spearheaded by the University of the Philippines, and we were able to implement this in some parts of the country through our local government units, our rural health units. So telemedicine is there already, but the value and the significance and the need for this was really not that appreciated since we started off with the pandemic. We had several lockdowns, community quarantine in different areas, and therefore people had lesser access to services for health. And this became a catalyst because people needing help, needing services like consultations, needing to see doctors when in fact they cannot go there face to face, this telemedicine has helped us a lot. When we started off introducing telemedicine in this pandemic, a lot of actors, especially the private sector, were really there to help us. They have offered their services for free. We were able to establish about 6 telemedicine service providers. All of them were private providers, and they were able to help a lot our patients. So this has given our patients more access to our services. They don't need to go to the hospitals anymore. They just need to call the telemedicine provider, and they will be managed accordingly. These also have strengthened our network of providers because from the telemedicine providers, we were able to streamline, we were able to prioritize patients that needed admissions, and therefore our emergency rooms, no, we were able to decongest because of these telemedicine providers. So we think that the pandemic has brought about the major significance of this digital transformation for health services in the country.
It really is all about coming together, right? Whether public or private.
That's right.
Yes. Economic leaders in the country, particularly the head of NEDA, predict faster economic recovery rate if the approach is to consider COVID-19 as endemic as opposed to pandemic, similar to what Singapore and Portugal did. So with that said, two questions come to mind. Are we at an actual point that we can start treating COVID-19 as endemic? And is it medically or epidemiologically justified to shift the mindset of the people to live with the virus?
Yes, Anne. So first, I just like to define what endemic means. When we talk about endemicity, it is that state wherein the disease that is present in your area has reached that level where it is already manageable, the cases already predictable, and the number of cases and the number of deaths are already acceptable to the society. So that is how we define endemicity. And also, when we define endemicity, it means that the number of those with immunity in the population is high enough to balance off the effects of those having still the disease in the area. So having said that, if you try to look at that, right now, a lot of things are not certain yet. When we talk about a pandemic, it means it's global in nature. It is not just the Philippines, but also includes the other countries all over the world. So when we declare a pandemic shifting into this endemic state, we need experts to guide us and to provide us with this assistance so that we can adequately review if ever the cases really are already manageable, it's predictable, it's acceptable to the society. A lot of people have this misconception about endemicity. They think that if we are in an endemic state already, no government actions are going to be done anymore, meaning restrictions will be out, there will be no wearing of masks, so on and so forth. But that is not the meaning of endemicity. When we talk about endemicity, there would still be government actions. There would still be implementation of safety protocols. What would just happen would be we live with the virus. So in your next question, you're saying that is it acceptable and is it epidemiologically or scientifically acceptable if we say that we live with the virus? We think that we should really learn how to live with the virus because we know that the COVID-19 virus will not go away. It's going to stay with us. So therefore, people has to live with the virus. And how do we live with the virus? We need to comply with whatever government will advise you on how you get to be safe. And that would be protecting yourself and your family by complying with the safety protocols that we say, like you wear your mask every day, you don't go to crowded areas, there should be adequate ventilation, and most specifically and especially, you should get yourselves vaccinated because this is the most important protection that we will get against this virus.
You mentioned vaccination, masks. So really, if we are to shift to that mindset, what else should everyone keep in mind when it comes to safety? Because we really do still have to be safe, but we also, like you mentioned, we need to live with the virus. COVID-19 is here forever, and we need to also move forward. So how do we keep in mind that there remains that threat, that we still have to be cautious? What other safety protocols would you recommend?
Yes, Anne. First, people has to be aware. I think that's very important. People needs to be aware that the virus is still here and the virus will stay. People has to be aware of the safety protocols or the safety nets that government has retained so that we will all still be protected. People has to be aware that even though you are fully vaccinated, for example, you can still get infected and you can still infect others. That's one. Second, the safety nets that are still there, we are not going to maybe remove the mask for a long time, even though that we have shifted to this, you say, endemic or this manageable state of this disease. The mask maybe would be the last to go, because you know what? The mask has provided us not just protection from the COVID-19 virus, but also it has protected a lot of people from the common respiratory infections that we usually have here in the country. Like, say, we have pneumonia, we have tuberculosis, and the other respiratory infections. Based from our studies and based on evidence, this type of infections like pneumonia and tuberculosis and the other respiratory infections have decreased by about 40% because of
Wow.
our wearing of the mask. So if ever the mask will be the last to go, because it has provided us with additional protection for the other respiratory infections. Aside from that, of course, there is that authority of government that if and when there would be outbreaks in the country, when we get to that stage of that it's manageable already, the COVID-19, but if there would be outbreaks, we need to be imposing, again, restrictions in these specific areas. So these are the safety nets that we have. We are not going to be complacent. We will remain to be vigilant, and we will remain to be closely monitoring the situation. But what is very important for all of us is to shift our mindset. We live with this virus. We do self-regulation. It is upon us to comply with the protocols, to have ourselves vaccinated so that we can sustain this kind of situation in the country and eventually get to that state of endemicity that we are all hoping for.
Yes. With that, with this new approach, how likely is it though that we would have another surge? Or better yet, how do we make sure that there will not be another surge should we shift to this different school of thought?
Well, first, I just like to again emphasize and reiterate, nothing is certain at this point. Um, Nobody knows. Even the experts across the globe cannot give you that assurance that there will be no surges anymore, that there will be no increase in cases, nobody will die anymore. Nothing is certain. A virus life cycle, it is normal or routine for them that as long as there are infected individuals, they can still mutate, they can still produce variants. So as long as transmission is happening here in our country or even outside of the country, the virus continuously mutates. It makes itself better. So it produces the different variants that we are having right now. And there is no certainty if they are going to produce another set of variants in the future. And with this introduction of the variants, that's the thing that may cause, or that's the factor that may cause another increase in the number of cases in our country or even in other countries in the world. Right now, what we are doing, we are able to sustain this low number of cases in the country because we have a increased, or we have a good vaccination coverage across the country. We have about 66 million individuals already vaccinated. We're looking for some about 20 million or 18 million individuals still to be vaccinated. But comparing with other countries, our vaccination coverage is good. If we are able to still improve on our vaccination, and our citizens will continue to comply with the minimum public health standards, will it be able to sustain this kind of situation in the country whereby cases are low and manageable. But as I've said, there are factors that may affect, even though we are all vaccinated, even though that we are complying with minimum public health standards, but once a variant is produced and it now has a different characteristic, maybe more transmissible, maybe it can also produce more severe infections, that's one of the things that we are trying to prepare for, because we know that that can also cause increase in the number of cases again, increase in hospital admissions, increase in deaths. So nothing is certain at this point. I cannot say if there's going to be a surge in the coming future or there will be no surge at all. What we all need to do right now is to prepare, to be aware, to be vigilant, so that when that time comes, if and when, we are all prepared and we can be able to manage that increase in cases.
That's so important for the public to know. It's really to remain vigilant, to be aware, and as we've been doing, to stay flexible and adapt, depending on how everything's going to go. Thank you so much, Dr. Vergere, for your time and the valuable information you have graciously shared with us today.
Thank you very much, Anne, at maraming salamat po sa inyong lahat.
We encourage everyone not to delay their care. Call 8988-7000 or visit the Medical City's official Facebook page and visit the Medical City today to know more about our campaigns. Maraming salamat to our guests and to everyone who is watching right now. I am Anne Gauthier and this has been Kapihan sa MV.